All right, we will be covering the cardiovascular system and blood vessels. Uh, Getting right to the point, in terms of the blood vessels, as you learned in anatomy, usually there are three different type of blood vessels. Okay, and the circulation is also similar. In other words, um, from arteries blood pathways goes into the arterioles. Arterioles are smaller arteries, so I'm just going to show you branches, all right? And notice the diameter is getting smaller. This happened to be arteriole. And then from there, arteriole sub branches into smaller arterioles, and finally, you know, there are really, really thin capillaries. So uh, the capillaries surrounding all our tissues. Okay, so pretend these are the capillaries. And again, I will discuss this shortly, but most of the time, uh, you know, uh, veins are shown in blue color. So, but before we get to the vein, as you know, there are branches of vein, and these are called venules. So, venules, and finally, you have the veins. All right. So usually the circulation is like that too. Now, on one end, the capillaries are facing arterioles. So this is the arterial ends of the capillary, and on one end you have the venules. This is the venial end of the capillaries. Okay. So usually, what we wanted to do is take a look at characteristics of arteries. Arterioles are similar to arteries, and characteristics of veins, and venules are similar to the veins, and also the capillary. So one of the things that are interesting is the direction. Um, if we go ahead and take a look at the idea uh, of arteries, capillaries, and veins, which is demonstrated in this picture, may not be a bad idea to maybe draw a heart right in here, okay? And the arrow is showing you the direction of the flow of the blood. In other words, arteries carry blood away from the heart. You could see this arrow is going away from this heart, right? It's going this way. And in terms of the veins, they carry blood towards the heart. So again, this arrow is going in towards the heart, is uh, the pathway or the direction in which the blood is. Now, capillaries right over here, that's where our tissues are. In other words, there are cells nearby these capillaries, all right? And again, due to having a very thin layer, this allows the exchange of substances to take place, all right? But let's go ahead and take a look at the arteries itself and find out what other characters. So that was the direction part. But what about the structure? All right. So the direction we just discussed. What about the structure? Structurally, they're all different, as you can see it in this particular case. Let's go ahead and take a look at the arteries. Arteries and veins, they are actually closely structurally similar to one another with a little bit of different. One, Let's take a look at the three layers. Both of veins and arteries, they have tunica interna or intima, tunica media, and tunica externa. All right. These are both, as you can see, they have these features similar in veins is shown to you. But what is different? Mostly the tunica media is different from arteries than from veins. So we'll get to that. But let's go ahead and take a look at tunica externa. It looks pretty identical, tunica externa. They're very much similar both in male, both in vein and in arteries. Uh, so they are quite similar. Majority of this tunica externa is connective tissues, a little bit of collagen fibers to give the protection, obviously, to the blood vessels. Tunica media is a lot thicker in the arteries as opposed to the veins. All right. Um, as you probably know, uh, majority of the arteries, the pressure is always also higher. So that's another differences. The pressure is higher, and the arteries has to withstand these blood pressure fluctuation and a smooth uh, muscles that making up the tunica media is capable of dilation and constriction, again for the flow of the uh, blood regulation. So um, they'll have more smooth muscle. All right. Depending on the artery, some of the arteries are elastic arteries, so they could have these elastic fibers in there. You can see there are elastic fibers as well. Elastic fibers, as they are stretching, they can have a recoiling capability, just like a rubber band. When you extend it and let go, it goes back to original way. So again, it helps out. All right. But smooth muscles are involved in vasoconstriction. Vasoconstriction is a way, and vasodilation. Uh, so if we go ahead and take a look at the idea of vasoconstriction and vasodilation, we see, for example, here is the active artery, and the diameter in this case, due to having the smooth muscles, is larger, so there is more flow is coming out, versus the same blood vessel can actually constrict due to this smooth muscles contraction and so on, and there's going to be a less flow. Flow and pressure, they have opposite relationship with one another. In this case, the pressure is going to be higher, and the pressure up here is going to be lower. Okay, so fluctuation of this pressure is important in regulation of blood flow, especially to the organ, whatever that organ may be. Okay, so in terms of the tunica interna, tunica interna is on the the most inside. And again, they are very similar, but take a look right over here. The vein has a larger diameter. The arteries has a smaller diameter. Again, keep in mind that there is a higher pressure in arteries and lower pressure in vein. All right. So this opening where the blood passing through is called lumen. So as the blood passing through this lumen, they come into a contact of these walls, all right? These walls of tunica interna, all right, when they do have larger diameter, they come into the contact of the wall lesser. So there are less resistance to flow. The pressure is already low. So they don't have to come into the wall as much. Right? They still do, but most of the ones that are in the middle, they're not coming into the contact of the wall. So basically, they're not going to get slowed down as much. Think about the freeway that is 5 lanes, all right, and think about the freeway that 5 lane has been closed. Maybe 4 lanes have been closed, only 1 lane is open. There's going to be more traffic congestion on that freeway because they come into contact of each other to the side of the freeway, and the flow of the traffic in this case, all right, is going to be having less resistance, just like the veins in this case, all right, the ones that have a larger lane, for example, or 5 lane open, for example. Okay, so arterioles right here, it leads to the capillaries right over here. Okay, so uh, arteriole, they still do vasodilation and vasoconstriction. All right. The smooth muscle is not as large as the arteries, especially the arteries that are next to the heart. They have a lot of elasticity. They do have a lot of smooth muscles and so on. As you go away from the heart, going into the arteriole, all right, these are the smaller arteries. That's what it is, and they will lead to the capillary bed, all right, which you can see it right over here. These are the arterial end of the capillaries, all right. So again, they can do dilation and constriction, and is quite evident in this case as well. However, let's go ahead and take a look at the flow of the blood going in from the arterioles to the capillaries, all right. So if we go ahead and take a look at the capillaries, um, only one red blood cell at a time can pass through. Pretend this is the RBC, red blood cell. All right, there's another one right here. There is another one right there. So think about, this is kind of like an alley that only one car can come in. And it's a one way. It cannot go back and forth. It's only one way. They need to go towards the venules and the veins. All right. So they basically, due to the red blood cell passing one at a time, they're getting a slowed down. All right. And this allows the exchange of material to take place with these tissues. All right. Carbon dioxide, for example, coming in and oxygen going out, nutrients, glucose, things of that nature, amino acids, things that the body requires. A lot of nutrients, a lot of vitamins, a lot of things can get exchanged right over here. All right. Now, um, as you know, the red blood cell has the hemoglobin, and we'll discuss this and other factors. But again, carbon dioxide can get inside of these blood vessels, and on the venule end, right over here, they merge into the major veins. All right, and that's what happens. Now, the capillaries are only one cell. They don't have this 3 layer anymore, right? This 3 layer was only for the veins and the arteries. So, therefore, therefore, as you can see, they cannot dilate, they cannot constrict. There's got to be another way to control the flow. All right. I'm going to get into that. But something that we wanted to stress, and is related to the previous lectures that you learned, happened to be before we get to the control. I'm going to get to the control a little bit later on. All right. So when you have the arteries, let's say these are the arteries, and now you have the capillaries. Capillaries, I'm just showing you two in this case. Capillaries are thinner, and then in the uh, eh, venial end, all right, right here. Okay, so take a look at what is happening. The diameter is going to get smaller right here, and the capillaries are more porous when the, you know, pressure that it's high in here. Pressure always goes from the high area to the low area. This side was veins. This side is artery. And as they come in over here, due to the nature of the capillaries, there are some water that are being lost in here. Again, uh, they are thinner, they are a little bit porous, and when the pressure is coming in high towards the area that is low, towards the vein side, all right, and they are subject to a smaller diameter, normally you would think that the pressure is going to go higher, but actually in here, the pressure is going to drop. You might say, well, wait a minute, I thought you said a smaller diameter, that means higher pressure. Yes, but think about the volume. Uh, some of this water is lost now, okay? Some of this water is lost, all right? The water is coming out. If you have a leakage in your pipe, all right, and you turn on your faucet, you might notice that the pressure is not as high as before, all right? So think of it as a leakage in the pipe. But something is interesting happens. Some of these water is going to go to the lymphatic system. All right. So they will be going back to the circulation using the lymph system. But here's the interesting part that is related to what we discussed. All right. As the water leaves, the solute stays. Remember, proteins and things like that, they're too large to pass. All right, they're too large, so creating higher solute inside now. All right, they're creating higher solute inside. All right, so via the osmosis, the water could get pulled back in now. All right, they can get pulled back in. Now the pressure is still is going to drop, right? Because you don't have that much. And now you're looking at the larger diameter as you're going into the veins. So that explains why the pressure is dropping, all right? But this water pulling in on the uh, venial end is going to at least have enough pressure so that they could go forward, one. And number two is this osmosis. So right there, if you have a problem with lack of protein, for example, the water is going to stay out. They don't want it to go back in. If they are staying out in the tissues, uh, you might have heard about edema or tissue swallowing up. Don't know if you've seen it, but sometimes, patients have a larger feet, like it's really puffy, or the arm is really puffy. This could be due to the liver problem. Most of the blood protein are being produced by the liver. And if you do not have the protein in here, what is that telling you? What is that telling you? That we need to erase some of these solute. So normally the solute is supposed to be higher, but now they are low, and not all the water is going to come back in. So some of the water is going to come back in because there's still some protein, some solute, some ions there, but not as much. So the water is going to stay out. If the water is going to stay out, then obviously, that's a problem. That's a problem because it indirectly tell you probably you have a problem with the solute inside. Water is not returning as much. Uh, you know, all kinds of problems. So now you have to think about the diagnostic. Going over how we can control the blood flow in the capillaries. Interestingly enough, the capillaries, at the junction of these capillaries, there is a precapillary sphincter. Think about it as valves that are automatically can open and close. due to the need of the body. So these precapillary sphincter right now, they are open. So you could see blood is flowing from the arterioles right here. This is arterioles and these are capillaries. As they're coming in, you know, they can go this way, they could 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 go all kinds of places. All right. But what if you do not want it to have so much blood flows everywhere in the tissues? And certain times, you can see there is a vascular shunt in the middle, and that is kind of like where the blood is going to feed off the other part of the capillaries as they're going through the surrounding tissues. These are tissues, these are cells around. There are plenty of cells around. But what if you wanted to bypass these cells and go somewhere else? All right. So precapillary sphincter, they could constrict. Now these are different because the vessels, they're not equipped with a smooth muscle, but at the junction of them, they're equipped with a smooth muscle. Precapillary is a smooth muscle. All right, so here's what happened. It's constricting, and you could see the blood is shunting to other areas in this case. If you ever been somewhere that was cold, for instance, you went maybe up in the mountains, some areas to see the snows and or skiing or whatever. As you looked at your hands, you notice like they are pale blue, especially if you don't have gloves on. You notice like, you know, not much blood is flowing there. That's why they look blue. All right. Now, at that time, you want the more blood towards the center. All right, because they're doing the thermoregulation and oxygen is needed for the vital organs and so on. So that's why, you know, the fingers, for example, tissue making up our fingers is not as important at that time. You wanted to bring in the blood towards the center. So this is how blood flow regulation occurs in the capillaries. All right. Now, there are vasomotor nerves and local chemical conditions that can bypass or flood the capillary beds. It really depends on what you needed, and that's what happens. All right. After that, as you can see, the blood enters the venules. And first is the smallest venules, and then, uh, this is post-capillary venules, and then the smaller venules, and then the veins. All right. So the venules have one or two layers of a smooth muscle, tunica media, and they're able to constrict and dilate too. However, most of the time, they're not as active as the arteries. Why? Because again, the pressure is very low to begin with. All right. But as we're going over the veins, then you have again thicker tunica externa that has collagen fibers and a little bit of elastic network and smooth muscles of the tunica medias, and but the pressure is falling. All right. Now, they have a special adaptation because the pressure is low. Let's go back here. We mentioned the pressure is low in here. If the pressure is low, then how are they supposed to make it to the heart? We know as soon as they make it to the heart is pumping device. We did discuss the contractility already. The ventricle is going to get filled and the heart is going to contract. All right. But this posing the pressure, posing a problem for us because it's pretty low. Again, there are features to help out the venous return. This is a venous return. Venous returns to the heart. Venous means veins. All right. So one feature is the larger diameter. All right. One feature is the larger diameter. In other words, larger diameter, less resistance to flow. All right. They can go there without too much resistance. It's like freeway is always open. Another features that you could see, there are valves. Valves, as you learned it earlier, they always prevent backflow. So let's pretend that there is another valve right over here. Once they pass in here, They cannot go backwards anymore. This closes. All right. So there is a resistance uh, or prevention of backflowing to occur if the valves are working properly, obviously. So valves are extremely important. The arteries or capillaries, they do not have this type of valves, as you know. And we wanted to also take a look at uh, factors that affecting or helping out the venous return. All right. There are factors, four factors that I would like to go over. One is the larger diameter we mentioned. All right. That's number two is the valves are present. Number three is a respiratory pump. So let's outline this. So one was a larger diameter. Number two was valves. These are all in veins, by the way. And the idea is what factors helping the venous return back to the heart. All right? Because remember, blood pressure is way too low. All right? You're not going to make it if you don't have these features. Then you have the muscular pump. And finally, you have respiratory pump. So muscular pump, if you think about a vein, all right, veins are surrounded by the muscles, majority of it. So you have muscles on here and here. When the muscles contract, what will happen is they are going to press, and because the muscle is contracting, they're going to press the outer part of the veins and causing the blood inside of the vein to go back where they're going. Why? Because again, there's a valve in here. They cannot go this way. They can only have one way. All right. So if you have a water bottle open and you squeeze it from the side, there's only one opening that they could go. Pretend that the bottom it has the valve. So and the valves we mentioned it prevent backflow. All right. So a skeletal muscle, there's a term, it's called milking the blood towards the heart. So it's kind of like that, directing it. All right. A skeletal muscle is extremely important, especially on the people that have varicose veins. You might have heard about varicose veins, right? So here's a nice picture of the muscular pump helping, all right? So if these valves you exhaust them, they are distended, they are ceased to work properly, then they get larger, and unfortunately, they don't do their job. This is where now, you have very large veins that are observable on the thigh areas and the lower part of the leg, for example, due to having this distended vein. This problem occurs more in female. The reason is sometimes the female could be pregnant. There is a lot of weight. There is a lot of, pressure that are building up. And unfortunately, that causes to have a lower pressure. And again, occupation that is causing long standing up for a long period of time. And these, you know, uh, veins they can get distended. Being an instructor, I have them because I always stand up after I develop a lot of these veins. I start lecturing while I was sitting down, if you remember. But a lot of times in the past I use standing up. I would come home and my legs were hurting and so on. One thing that you could do is strengthening your leg muscles. All right. And again, it happens mostly in female because they have less skeletal muscle mass. All right. So that's what happens. All right. But female live longer. So if you're a female individual, don't worry too much about this. All right. Besides, there are a lot of procedures that you could get rid of it, and wearing this socks that are really tight can help out, you know. So there are different factors. How about the respiratory pump? Let's go ahead and take a look. Now, respiratory pump, maybe we can shed some light when we cover the respiratory system, but the respiratory pump is important too. The pressure changes created during the breathing sucks the blood towards the heart by squeezing the local veins. All right. So again, there's a lot when you inhale, exhale, there's a lot of pressure that it changes. And when that changes occurs is actually a negative pressure that is building up in your lungs and so on. So all of these, it helps to bring back the pressure that is very low in here back towards the heart. Once they reach the heart, and you know, we're talking about the vena cava, for example, and now you're in the right atrium, and then it flows passively mostly to the ventricles. Of course, the atrium contracts at the end, and at the end of the first cycle, ventricular filling, and then as the ventricle contracts, you're okay because from then on, you know, you're building up some pressure, and the lungs is not that far from the heart to begin with. The challenge is all these veins coming in and merging into the inferior vena cava specifically, but also the superior vena cava as well. All right. So those are the four factors aiding or helping the venous return. All right. So we discussed the role of the precapillaries, and let's see. We are moving right along, and we are going in through the veins, and we wanted to talk a little bit about. Uh, let's see. All right. We mentioned that these features help the low blood pressure reaching the heart. Okay. Now, you might see some term is called vascular anastomosis. Vascular anastomosis is when the blood vessels are merging. This is more common in veins than arteries, all right? But it provides alternative pathways, also known as a collateral channels for the blood to reach a part of the tissues, part of the areas. Let me demonstrate this. You know, you could pause for a minute and take a look at, you know, your forearm. Here's your forearm. Here's the fingers, for example, of your left hand. And if you look at your forearm, again, really depends. If it's cold, you may not be able to see it as much because vasoconstriction is happening. But for the most part, either back of the forearm or anterior part of the forearm, you might be able to see some blood vessels. And if you look carefully, some of these they merge in one another. So this is what it means. So if the direction of the blood flow to your muscles or to your arm, or forearm, tissues, and so on is this way, all right. If let's say one channel is blocked, let's say this one is blocked, there is still ways to get there. Okay, there's still get ways to get to the tissues of the finger, for example, because they don't have to go through this blood vessel that have an X mark on it. That one is branch is closed, all right, is blocked, let's say, for whatever reason. there's a blood clot forming, and so on. But there are other alternative route basically. And these are called collateral channels. That means they're going to the same directions. All right, this is particularly useful and is termed vascular anastomosis because, again, when one channel is blocked, you still can get there. Imagine that you're going to home from one area, maybe you went shopping and then now you want to go home, but all of a sudden, one street that you usually take to go home is closed. But that's okay, you don't have to take that street, you can go from the next street and still get there. Right? So that's the idea behind it. All right. And this is particularly important. However, we do not have this vascular anastomosis all the time everywhere. For example, uh, when you go to Las Vegas, there's only one road that reaches there, on one road coming back in the middle, Freeway 15. And if that one is closed, then you stuck. So we go ahead and take a look at the heart. Major blood vessels going to the heart is the coronary artery right here. And this is the major, uh, you know, bringing the blood to the heart. But if this one is blocked, there is no alternative pathway. All right. So again, this could probably cause a major heart attack because this part is blocked. That's why arteriosclerosis is dangerous, specifically if happens to be near the heart. All right, so we could go ahead and talk a little bit about the pressure now. And the pressure is particularly important. Uh, Blood pressure, force per unit area uh, exerted on the wall of blood vessels uh, containing the blood. We usually use millimeter mercury or Hg. The differences in blood pressure within the vascular system, basically giving us an idea or provide the driving force, allowing the blood to move from again higher to the low blood pressure areas. And we already talked a little bit about the resistance, opposition to flow, but we wanted to kind of like talk about what are the factors that are affecting the blood pressure. All right. So, uh, three factors that are affecting the blood pressure that are really important are as follows. One is the viscosity. All right. Viscosity. Let's go ahead and take a look at the viscosity. Uh, if your blood is more viscous, for whatever reason, maybe you have too many red blood cells, maybe you know your uh, uh, blood is viscous for other reasons, maybe you have too much proteins in there, and so on. Think about oil versus water. Oil is very viscous. When you have a container of oil and invert it, oil comes out very slowly. Water comes out right away. So the oil is more viscous. All right. And that could cause the pressure to go up. Here's the reason why. Here you have a syringe, for example. Let's say it consists of, I don't know, 30 cc of water inside. So you could put water inside, and same amount, 30 cc, put honey inside. All right. So here is water, and here is honey. Same amount. These syringes are identical, and so on. Now, if you want to get this amount out, all right, you obviously have to put in more pressure on the honey, the one that contains the honey. All right. This requires more pressure to get the same amount out. You got to apply more pressure in here in order to get them out. In the water, no, you just boom, it comes out right away. So you could see why the pressure is increasing when the blood is viscous, obviously. People that have a high blood pressure, sometimes they are given aspirin. Aspirin is blood thinner. So blood gets thin, that means less resistance to flow. Because if you have your blood vessels, and if you have a lot of red blood cells in there, again, they're gonna come in uh, to the walls. These are resistance factors more often. It's kind of like creating friction among them. Now, the ones that are in middle, like sometimes it's known as laminar flow, is just freely going. They're not going to come into the walls that much. So they are still going. But the more that you have, it's kind of like, there's a traffic jam and there's like so many of these and so on. They're going to come into a contact of one another, and they're going to come into a contact of these walls more often. So obviously, this is going to create problem, and this is because of the viscosity. That's the idea. All right, next up, we got the total blood vessel length. All right, the total blood vessel's length is another factor that is important. All right, now, if you have a longer blood vessels, all right, now they're coming into these walls more often. So again, the pressure is going to increase. If there is a shorter blood vessel length, then they're going to have lesser. So blood pressure is going to be, different in the people that have blood vessel length. Now, how do you know you have a longer blood vessel length or shorter blood vessel length? Well, think about it. I mean, you don't have to compare two people with one another. You could compare like two people with a different age group. Okay, like a kid versus an adult. Adult is a lot bigger, a lot, taller, and therefore blood vessels length is, lengthier, obviously. So again, think about that. They're gonna come in. The blood is gonna come into these walls more often, and as a result of that, the pressure tends to be higher. Okay, all right. So think about that. Now, I'm not going to reveal the answers. Don't just look it up, just think about it. Do you think the blood pressure of a giraffe is going to be uh, higher? Or do you think the blood vessels of a horse is going to be uh, higher? Again, assume that they're, you know, uh, relatively, relatively, the giraffe is going to be bigger and taller, obviously. So think about the blood vessel length and see if you can, you know, maybe discuss that among yourself without looking it up. Think about it first. All right, put it on the paper if you have to, and then think about it to see what do you think is happening on the blood vessel length and why. All right, rather than just memorizing, oh, viscous, more pressure. But why? I just mentioned that. Blood vessel, why? I just mentioned that, right? So make sure you know the reasons why. Okay, blood vessel diameter now. Blood vessel diameter plays an important role as well. Now, if you washed your car using the hose, uh, 37. So let me see if we can go ahead and take a look. Use the hose to wash the car, and you turn on the water so the flow is coming in, but you notice that there's a lot of dirt on your car. You put your fingers halfway through right over here, okay, as you are watering, uh, and now there's only this amount that is coming out, but you notice the pressure was increased when you blocked the hose halfway, opening halfway, for example. And that is higher pressure to allow, get the dirt off of your car. So the pressure in this case is higher because you're lowering a smaller diameter. And that's what happens. All right. And blood vessel diameter is important factor. All right. And as you can see, their blood vessels can have fatty plaques forming in there. This could be cholesterol, this could be deposits, lipid deposits, and things like that. All right, this is also known as atherosclerosis. And, this plaque formation is occurring. And as a result of that, now you have lower diameter, all right? And the pressure is now is higher. This pressure going high is not a good thing, okay? Because when you get to the capillaries, as we mentioned, it was very much, uh, it was very much thin. So they're very fragile. What that allows to do is that, they are fragile. They could get busted, they get ruptured, and you could have a lot of problems, obviously. Another thing that is interesting and can share with you is when you're looking at the blood vessel, here is a blood vessel. When you're looking at the blood vessel, blood supposed to go continuous, no interruption whatsoever. This continuous flow is important and ensure that you're giving adequate amount of nutrients, oxygen, things and that towards the tissues. But during the arteriosclerosis, you no longer is going to get a continuous flow. For example, blood inside, they're going to come over here. They're going to stretch this part, all right? And then it's going to come over here, and then it's going to go, all right? That's what's going to happen. Again, it's going to go, all right? So you could see there is a little bit disruption. This is called turbulent. So there is a turbulent blood flow in this case. Well, what does it do? Now you don't have the smooth, continuous blood flow. That's one. Number two, this part right over here, it keeps on getting stretched out, right? It's stretched out, all right? So it's actually getting, the arteries is going to get harder in this case. Hardening of the artery is known as arteriosclerosis. Artery is becoming harder because what happened is pressure keeps fluctuating and there is not enough room to keep on stretching and so on. So this is subject to more damages now. So if this part is getting more fragile due to the hardening of the arteries and losing the elasticities and such, then at one point in time, as these plaques forming more or as the blood flowing through the area, it could burst. And we're not looking at the small capillary that could heal itself very quickly with the platelets. We're talking about massive bleeding, massive blood loss, and so on. And sometimes this could happen internally, so we don't have access to it. All right. If the blood vessels of the heart, for example, something like that happens, it's a big deal. It's hard to recover after that, as you can imagine. Okay, so this is also important, and I wanted to bring it up to your attention. Um, the blood pressure is need to be monitored. They need to be measured all the time, and making sure that everything is safe, everything is within the boundaries, within the homeostasis, and you don't want any problems, obviously. All right. Uh, you have to have a good diet. You have to have a good gene. You gotta have exercise here and there, so that these plaques doesn't build up. It can happen. It could be genetics too. So again, having good nutrients with fibers and vegetables and all that, that we can discuss that a little bit later on during the maybe our discussion of the digestive system. That would be a little bit more appropriate. All right. So we'll go ahead and take a look at the blood pressure changes throughout the blood vessels. Let's go ahead and take a look at this diagram right here. And you could see our aorta blood pressure is very high. Arteries, sometimes you put the pressure cuff on your left arm and they give the high 120. You could see 120 right over here. This falls in the arteries. And again, you could see the lowest pressure right over here is a diastolic and versus systolic. And you could see it's fluctuating due to the elasticity, due to the thicker, smooth muscles and so on, and due to the pressure that is high, so when the heart is contract, the pressure is high, it expands, blood expands inside and pressing on the arteries. This is the reason why you could feel your pulse, by the way. All right, as the heart contracts and relax, blood vessels expand and go back to normal, and that because of the elastic fibers, and you could feel it as a pulse, especially on the carotid artery or radial artery that is usually taken. All right, as you go through the arterioles, again, the pressure is dropping. Take a look. This y-axis is demonstrating the pressure, and the fluctuation is less and less. So from here to here is the arterioles. So you could see the pressure is dropping. You're going towards maybe around 40, and the fluctuation is less and less and less because, again, you have less elasticity and less smooth muscle. As you go to the capillaries, the pressure happen to be between 20 to 40. All right, 20 to 40. The pressure is dropping tremendously. Again, this makes sense because we mentioned that some of the water exit, and we also mentioned that the capillaries are smaller in diameter. All right, and there are more resistance, and the pressure is keep falling. But this pressure needs to be falling because you want the blood to get slowed down so substances can get exchanged. Venules, again, pressure is dropping. Veins, again, pressure is dropping. When you get to the vena cava, you could see the pressure is nearly zero. So you could see that, you know, uh, if the pressure goes even lower, they're probably not going to be able to make it. And that's where the factors helping the blood pressure return back into the hearts is what we discuss. Factors aiding the blood return or venous return. All right. So the elasticity near in the arteries blood pressure is important for this fluctuation, obviously, and uh, right over here, because it gives them the recoiling capability. um, Usually when we say systolic pressure is really uh, when the pressure is the highest. All right, systolic pressure. This happens during the ventricular contraction. All right. Diastolic when the pressure is the lowest. This happens during the, uh, you know, uh, pressure is the lowest. Ventricles are resting or relaxing. All right. So that's diastolic. What is pulse pressure now? Pulse pressure is different than pulse rate. Pulse rate is the same thing as a heart rate. Right? Pulse pressure is the differences of the systolic and diastolic pressure. So you're familiar with 120 over 80. 120 was the systolic and 80 was diastolic pressure. All right. And the difference between the two is 40. 120 minus 80, and that would be 40, right? So 40 millimeter a G would be your pulse pressure. So that's as easy as it gets. Mean arterial pressure, mean is the average, all right? And you should know this formula, MAP is equals to diastolic pressure. In our case, diastolic is 80 plus 1/3 of the pulse pressure. In this case, pulse pressure we mentioned was a 40. So 40 divided by 3, don't have a calculator, but my guess would be 13.3333. So 13.333 plus 80, that gives us roughly, you could double check, but about what do we get? 13 plus 80, that's 93.3, somewhere around 93, more or less. All right. All right. Maybe 0.3 if you want it. It's fine. Okay. So if you look at this 93, and we're looking at the pressure 120 when it's highest and 80 when it's lowest, kind of like draw a mapping here. This is 120. This is an 80. All right. And 93, where would that fall in? I mean, 100 would be somewhere in here, right? Halfway. All right. So 93 would be maybe around here somewhere. All right. So you could see 93 is closer to the diastolic pressure. All right. Versus earlier, you probably learned mean or the average if taking two numbers and dividing by two. So why not 120 plus 80, all right, and then divided by two. So that would be what? That's 200 divided by two, that would be 100. Why not 100 as opposed to 93? Why not to be right in the middle? Why is this pressure is closer to the 80? If you want, you could pause the video and see if you could find that answer, all right, or guess before I reveal it for you. Okay, so is because the heart stays in relaxed position and filling and such more. If you recall, it takes longer for the heart to get filled with blood. So during these activities, we have isovolumetric relaxation followed by ventricular filling and so on. The part of a contraction of the ventricle and so on is quicker time. You spend more time filling up the blood than pumping it. So that's why this number is closer to uh, the diastolic pressure. That's the reason why. All right, and that makes more sense to us. All right. So blood pressure, as you know, has to be monitored uh, and looked at. So let's go ahead and take a look. Capillaries, we mentioned 20 to 40. Low capillary pressure, it's desirable because they're very fragile and they could burst. We discussed how it is sufficient to have low blood pressure, especially in the capillaries, so substances can get exchanged. These substances could be nutrients, gases, hormones, you know, vitamins and things in that nature, obviously. All right. So we mentioned all of these already. We'll go to the aiding the venous return. We mentioned that as well. So we kind of like went through it a little bit more organized way. Now we are going through a little bit about regulation and maintaining the blood pressure. If you remember, we mentioned that the cardiac output was equals to heart rate multiplied by stroke volume. All right. In this case, you are need to know another equation, and that is blood pressure BP equals to cardiac output multiplied by peripheral resistance. All right. Again, the peripheral resistance, you could think about you know, the resistance factor as peripheral resistance. Sometimes it's also known as vascular resistance. It's the same thing, or intervascular resistance. It's the same thing. All right. So three factors that were important in the peripheral resistance we mentioned was blood vessel length, the diameter, and also the viscosity. All right. So blood pressure is directly dependent on these uh, equation. If, for example, the blood vessel diameter it gets smaller due to building up of the lipid deposits and so on. Now the diameter is going to get affected. Right here, the diameter is not as much. So right here, peripheral resistance is going to go up. We don't have much information about the cardiac output. I'm not going to put up or down because we don't have any information about it. All right. Assume that it's not changing. All right. Still, blood pressure is going to go up. All right. simply by just looking at it. Blood viscosity, same thing. Blood vessel length, same thing. They're all increasing blood pressure, peripheral resistance, and therefore the pressure is going to go up, as you can see. All right. So um, we may not be able to take a look at all the pressure changes and such, and but we can go ahead and take a look at few mechanism in action uh, of how we can regulate the blood pressure. All right, and let's see about. Okay, so if you recall, uh, if you want to see the overall picture, blood pressure, there are two factors of cardiac output and peripheral resistance. They are important. When the peripheral resistance goes up, so as the blood pressure. We just demonstrated that. Three factors that are affecting the blood pressure, peripheral resistance were blood vessel length, it was the diameter, and it was the viscosity. Right? Cardiac output. Cardiac output, two factor of heart rate and multiplied by stroke volume were important. Again, we discussed the factors that are affecting the heart rate, you know, thyroxine, certain hormones, and all that. Uh, Sympathetic activity, parasympathetic activities, and such. And the stroke volume, we mentioned that there were three factors of uh, preload, contractility, and afterload were important. So each of these we explain and we mention the reasons and we went through it pretty extensively. So preload we discuss it was related to about before the heart was getting filled, contractility, again, the force of contraction. After load, again, we discuss how it can affect the stroke volume. So those factors are in place. Again, there were certain chemicals that were affecting the heart rate, if you remember, the epinephrine, uh, neuroepinephrine. So uh, epinephrine from the medulla we mentioned that can increase the heart rate, for example. We mentioned, and also epinephrine, neuroepinephrine. We mentioned thyroxine, if you remember. Okay. We mentioned the concentration of calcium. All right. Uh, for the normal heart and potassium. We discussed this. Of course, these two were affecting the contractility too, so don't mix them up. But basically, it really depends on the scenario, and you can think about it. Now, blood pressure, I'm just going to put this right over here, can be affected by intravascular volume. All right. So if you donate blood, for example, your volume is going to be low. If you have maybe damage to your blood vessels and internal bleeding somewhere, hemorrhage, for example, this is going to cause the volume to go low, and the pressure is going to be low because of the volume. In this case, diameter didn't change, viscosity didn't change, length didn't change. All right. So, but it still is a factor, and it can affect a blood pressure, as you can see. Increasing volume can also cause problem. So, increasing in volume, a person keep drinking water without using a restroom. For whatever reason, maybe a person is in an airplane, the restroom is not working. All right, maybe they are in the road and there's no point to stop, but it's hot and the person keeps drinking water. Or maybe the person is unconscious and extra IV is being administered. Either way, all of those is going to increase the volume and therefore increasing the pressure. All right. To demonstrate this, you could think about two faucets again. All right. One faucet is the first time you're using it. You're just turning it one time. Look at the amount of water that's coming out. But versus this one, you do it maybe 5 times. You turn it, opening it up, and so on. Right? In this case, the diameter is the same. Your diameter of the faucet didn't change, right? But the volume changed. You bring in more water. Obviously, this is going to have more volume, and therefore, this one is going to have higher pressure in this case. All right, and you could do that at home. All right. So yes, we also mentioned influencing the heart rate could be age, gender, body temperature, exercises, and dust. Lots of things can affect the heart rate as well. But this is an overall picture. You have to really think about this to see what will happen that makes sense to you. And I'm just going to give you a few examples during the uh, during the uh, exercise, for example. During exercise, obviously venous return is going to be higher, contractility is going to be higher, and therefore the stroke volume is going to go higher. Because of the stroke volume is going to go higher, the cardiac output is going to be higher. Because the cardiac output is going to be higher, blood pressure is going to be higher. In other words, if you have a blood pressure devices and you exercise and then put the blood pressure, you notice that the pressure is going to be higher. Okay, so in this case, that's what happens. All right, so very simple. Now, as far as the heart rate goes, heart rate is also goes higher. All right, during the exercises, as we mentioned, exercises, sympathetic activity, there is more norepinephrine, and that causes the heart to, by the mechanism that we discussed earlier, if you remember, it was a G-link protein and so on, there's more availability of the calcium, and therefore heart rate is going to go higher, cardiac output is going to go higher, blood pressure is going to go higher. All right. So you could see also the temperature was one of the factors that can affect the heart rate. So while you are exercising, your muscles are like mm, friction is contracting and relaxing and increasing the temperature, which is increasing the heart rate, and therefore cardiac output goes up, blood pressure goes up. All right. So you can think about different scenario. All right. A person is excessively sweating, for example, during exercise without having water. That's volume. All right. The volume is getting lower. In this case, blood pressure is going to get lower. Parasympathetic activity, again, all the arrow would be lower now, and the blood pressure is going to be lower. All right. So you could see how important it is to take a look at the overall picture as we discuss and identify, be able to identify which part is affected to understand, for example, which factors of the blood pressure are being affected. So this is overall picture. I thought to bring it in and blend it in with the stuff that you learned earlier to complement that and help you understand this a little bit better. Okay, moving right along, let's go ahead and take a look at the mechanism of it. The blood pressure, how you're taking it, I think that's pretty straightforward. I would like you guys to know it, so make sure you look at it. All right, how you put the pressure cuff around your arm, you know, and you inflate it with air, and then you let go. In demonstration that you guys did on the activity, it kind of like demonstrated that as well. Uh, when you were taking the blood pressure or simulation of that. So you have some idea behind it, but again, look it up. There's tons of stuff in YouTube and other places as well. All right, so let's go ahead and take a look at some of the neural control mechanism to know what we need to do. Obviously, if the blood pressure keeps going up, that's not advantage because, you know, eventually they're going to burst all the capillaries. And if the blood pressure continually goes down, that's not enough pressure for the venous to return back to the heart. And again, you're not going to have oxygenation of the brain, oxygenation of the vital organs, and the person can collapse. All right. So how do we distribute the blood in a way that everything is maintained? All right. So maintaining a MAP requires alteration of the blood vessel diameter. Right. In other words, to control the blood pressure, I mean, can you really decrease or increase the length? No. Do you really can make your blood more viscous or less viscous? Not really. I mean, everything is maintained by itself. It's kind of like out of our control for the most part. I mean, you're not going to be able to drink more water because if you do, yeah, pressure is going to go up, but you're going to use the restroom and then pressure is going to be maintained. All right. You can't do throughout the day that either. All right. So we need a mechanism. And the mechanism I wanted to talk to you about is the vasomotor system and baroreceptors. All right. So as you know, there are the smooth muscles in the blood vessels. And if we can monitor and increase or decrease the diameter, then we got it made. All right, then we can average this and maintain the MAP so that it's not too high that cause the blood vessel to rupture, and it's not going to be too low that we're not delivering the material to our tissues. So let's go ahead and take a look at how this works a little bit. So during the sympathetic activity, vasoconstriction is going to occur, okay? Norepinephrine is a vasoconstrictor. As vasoconstriction is occurring, that by itself is going to increase the blood pressure. This is the reason when you are scared, if somebody take your blood pressure, it'll be high, all right? So, opposite can happen too. So baroreceptors, they are kind of like a mechanoreceptor, but they detect pressure differences. Right? When you have a rise in pressure inside of the blood vessels, they can detect that. Again, think about that you have a hose in your fingers, in your hands, and you're squeezing it, and somebody opened the faucet, for example, while you're holding on the hose, you feel the water flowing inside. Even if your ears are plugged, you feel the force pressing against the hose, and you feel that. Your fingers act kind of like a baroreceptors. You're detecting the pressure. All right. Now, whether you want to squeeze that hose or let it go and not squeeze to monitor the blood pressure, the pressure in this case of the water flowing, this is very similar. All right. So there are chemoreceptors. We're going to discuss that in the respiratory system. You're detecting carbon dioxide, pH, and the oxygen. All right. But there are other things that can affect the vasomotor activities, obviously. But we're going to put our focus on the baroreceptors now. So let's go ahead and take a look what happens. When the blood pressure rises, you want to do opposite. You want it to lower things because you don't want it to keep rising, right? So cardioinhibitory centers is going to increase the blood vessel diameter. Blood vessel diameter is increasing, the pressure goes down. On the other hand, you wanted to lower the heart rate. Again, think about the overall picture we discussed. Cardiac output, peripheral resistance, and blood pressure. So all of those, when we're decreasing it, obviously you want to decrease the blood pressure. All right. And that's what you want. Why? Because in this case, you had increase in blood pressure. All right. In order to make this a little bit more sense, we can go ahead and take a look at opposite. In other words, what happens when the blood pressure is dropping? Again, now you need to accelerate cardiovascular system. In other words, you need to increase the cardiac output, because when the cardiac output goes up, the blood pressure goes up. BP was equals cardiac output multiplied by peripheral resistance, which is again factors that can affect the pressure. All right, the resistance factor we discussed. All right. On the other hand, we also, when there is a low blood pressure, we wanted to stimulate vasomotor to constrict, because when they constrict, blood pressure is going to go up. All right, so that's exactly what we wanted to do. And this picture is demonstrating that. Let's go ahead and take a look at what happens when the blood pressure is higher. We're looking at the baroreceptor activity. There are other mechanisms to control the blood pressure. Don't get me wrong. Some of those mechanisms I'm going to cover in the kidneys, because that's where it comes alive, and we can discuss it a little bit later on. But anyways, rising in blood pressure is something that is happening. Now there is a baroreceptor. So where is the location of these baroreceptors? These are located in the carotid arteries and aortic arch. So you could see carotid arteries and aorta. All right, these are major blood vessels near the heart. It makes sense because you want to detect that pressure early on, okay? Because the pressure is the highest. So they are compressing against these mechano or pressure sensitive receptors. And then this information is going to send into the brain. These impulses from this baroreceptor is going to cause the cardio inhibitory centers. In other words, you are lowering the heart rate by the phenomena we discussed earlier, availability, lower amount of norepinephrine, and therefore, less come into contact of the G-link protein, and ultimately less calcium, and ultimately less binding of the troponin, tropomyosin, and basically the heart rate is going to be lower. As the heart rate gets lower, again, this is going to affect the cardiac output, obviously. All right. You also wanted to decrease sympathetic activity. By decreasing sympathetic activity, again, right away, you could think about what happens. Heart rate goes down. Cardiac output is going down. We know what happens in the sympathetic activity. All right. When that inhibits, that means what? Now there is less contractility, right? Less contractility was which factor? Was a stroke volume factor. Heart rate is also going down. So again, cardiac output was equals to heart rate multiplied by stroke volume. When contractility is lower because the sympathetic activity is being blocked, when the heart rate is lower, obviously cardiac output is going to be lower. That's where we're getting this. Do not memorize this. All right. Also, the vasomotor activity, think about that this nerve coming in here, and they're releasing their neurotransmitters, and as a result of that, the blood vessels can constrict or dilate. Think about these neurotransmitter constantly are being released a little bit. So when you stop that, what happens then? Blood vessels, when they are releasing a little bit of neurotransmitter, they are, like, let's say norepinephrine, they are partially constricted. When you stop that, it's going to get dilated. When you release that more, it's going to get more constricted. So in this case, it says that impulses decline. So in other words, we're releasing less vasoconstricting neurotransmitters, And as a result of that, there's going to be vasodilation. As you know, the vasodilation was part of the peripheral resistance factor, and blood pressure was equals to cardiac output, which we already know it was lower because we demonstrated that. Why? So that is lower, and multiply by peripheral resistance. One of the factor of the peripheral resistance was the diameter. That was a major factor. And again, when the diameter is increasing, all right, what we wanted to do is lower the peripheral resistance so we can lower the blood pressure. And that's what we want because the pressure was high. We wanted to lower it, and that's what we did. All right. Now, down here is the same scenario, except that the blood pressure is declining. So what we wanted to do, we wanted to increase the blood pressure. Too low of the blood pressure is problematic. If you're getting up and all of a sudden you don't have enough pressure, you're going to faint, all right? Because you don't have enough pressure to reach the blood, send the blood to the brain. The brain is not functioning, all right? When you donate your blood pressure is going to be lower now because you have less volume in this case. Intravascular volume is affected. In this case, it didn't tell us why the blood pressure is falling. Maybe excessive sweating. Maybe the person is vomiting. When you vomit, you lose a lot of fluid. Maybe the person had diarrhea. When you have a diarrhea, you're losing a lot of fluid. All of this, what is it going to do? It's going to have lower volume. Lower volume is going to cause lower blood pressure, right? What do we need to do? We need to increase it. Otherwise, you can't function, all right? So baroreceptors, again, in the carotid and the aorta will detect less force is going to be exerted. Now you are stimulating vasomotor centers. What is the vasomotor centers is going to do? They're going to release more vasoconstrictive chemicals. So it's going to have vasoconstriction. That by itself is going to increase the peripheral resistance. When the peripheral resistance is higher, blood pressure is going to get higher. But also you're going to kick in. This is emergency. Emergency was associated with the sympathetic activity. Blood pressure is low, it's emergency. So sympathetic activity kicks in. That causes more heart rate. Again, we discussed this already. More contractility, right? Both contractility is going to increase the stroke volume. Increasing heart rate is going to increase the cardiac output, and that's why you see cardiac output. So what happens then, your blood pressure is going to go higher. Blood pressure is going to be higher now. It was low in here. All right. So it's important to appreciate what is happening, what are the, you know, the idea, the concept behind it, and go from there. Now, another concept is monitoring circulatory efficiency. In other words, by taking pulse, by taking blood pressure, we want to make sure everything is normal and everything is working just fine. Even though you might have a little bit of fluctuation, you could correct yourself. That's why we take the vital sign. We take the blood pressure, we take the pulse, we make sure the temperature is normal, we make sure that the respiratory rate is normal. Pulse, we already discussed it, how you're taking it. You already took it early on, so you have some familiarity. You could just go ahead and take a look at it. A sphygmomanometer is basically a device for taking the blood pressure. Again, for this part, you need to look at the YouTube videos. I'll try to demonstrate this a little bit, but you need to have the stethoscope and the pressure cuffs, and it's important to detect the sounds, but really these things comes in live in the laboratory. You can take a look at some videos that are out there, and I notice some of you guys encouraging others to look at the videos on the YouTube on the discussion. I welcome that, and this is pretty valuable. Take advantage of it. Somebody already looked that up and sharing the knowledge, the information with you. It would be a pity if you're not looking into it. All right. So go ahead, and if you've come across a good videos or something, share it on the discussion. We're all here to learn. You're not really competing with somebody else in here. We're all here to learn. And what better way to learn to share the knowledge and information or something that you find valuable. All right. So I looked that up a little bit later. In general, usually the left arm is being used. All right, here is the left arm, and there is a brachial artery. This is a major artery that again splits and it goes into the forearm. You put the pressure cuff right around here because this is the left arm, and left brachial artery is closest to the heart. So once you put the pressure cuff, this is attached to the, a pump. So when you're pumping it, and this is a valve, the air is going to go in there and is going to inflate with air and causing this brachial artery to mm, have less flow because of the air compressing against these arteries. And at this point in time, there is a gauge that you could take a look at, and maybe it's around maybe 140 millimeter Hg and so on. And then you put the stethoscope right around here. All right, and you put this part in the ears, you listen to that. All right, and and uh, and then you open this valve. Once you open this valve, the blood is going to rush through the forearm, and that's where you're picking up the sound right here. All right, you're picking up the sound, is a whooshing sounds or thumping sound. And then at the time that the sound appears, you have to look at your gauge. Most likely it'll be around 120. That's your systolic pressure. That's pressure is highest. After a little bit time passes by, the pressure keeps dropping and the sound is gonna get lower and lower, and then it disappears. And you have to look at the gauge as well, and that would be 80. All right. Nowadays there are all kinds of automatic ones that you could take. Some people, they put it on the wrist. On the wrist is not a good idea that much, because if you put this pressure cuffs on the wrist, this is farther away from the major source, the heart. So obviously the pressure is going to be lower. This might make you feel comfortable because your pressure is lower, but it's not as accurate as the ones that are on the arm because it's closer to the heart. As you're going away from the heart, the pressure drops. We mentioned that already. It's a good idea to do the blood pressure over the course of 24 hours. As you know, when you're active, it's daytime, you're more active and so on. Your pressure tends to be higher. As you're less active during your sleeping or perhaps early in the morning and such, the pressure is lower. All right. So you got to take an average of it and find out where you stand. Age, sex, weight, race, mood, posture, lots of things can actually affect it. One of the things that we did in the lab in the previous semester, uh, where you had hands-on, I had individual, sitting down and standing up and in being in reclining position and taking a blood pressure and comparing that. You guys can look that up. I'm not gonna go over everything with you, but again, think about why standing up the pressure might be different than lying down. Which one your heart has to work harder? All right. Think about the force of gravity. Think about all the factors that we discuss. Why do you think age is affecting the blood pressure? Why do you think the older person have more, uh, you know, higher blood pressure for the most part? You know, why do you think that? Maybe the arteries, they have more plaques on it. Maybe they are more nervous. You know, think about that and look that up. Why do you think male are more prone to cardiovascular diseases, heart attack, things like that, plaques forming? Weight, again, think about the weight. Why do you think the weight have anything to do with it? Well, race is the genetic part, and so on. So it runs through the family. If you have a high blood pressure or bypass surgery in your family members and so on, you'd be a good candidate to have heart problems too. Mood, we already discussed sympathetic, parasympathetic activity. Posture, again, sitting down, reclining, different things. Physical activity, all of those. As you can see, there are different factors. These are called extrinsic factor, folks. All right. So there is a phenomenon known as a hypotension and hypertension. Hypotension, when the low blood pressure is occurring, systolic pressure is way below, uh, and sometimes below 100 millimeter Hg hypotension, right? Which again, not enough pressure to supply the demand. Hypertension is also problematic. Now you get too much pressure, and again, it could have, causing the blood vessels to burst. That's very dangerous. Capillaries are very fragile. They don't do very well under higher uh, uh, pressure. All right. And again, could be fever, could be physical exertion, emotional upset, lots of things can happen. All right. A lot of times, chronic elevation of the blood pressure is causing a heart failure because your heart is working so hard to, do all these activities and so on, and it gets exhausted after a while. All right. So delivery of the oxygen and nutrients and removing of the waste and such is important to have a right flow. Gas exchange in the lungs, again, blood flow is important for that reason as well. For absorption of the nutrients and urine formation, the blood flow has to be monitored. All right, there gotta be a right amount. You don't want too much or too little. All right, you want to adjust things so that they work efficiency. All right, all of these, if there's low blood flow, there's problem. In gas exchange, you have low oxygen gas exchange. Now your cells is going to crave for oxygen. Okay. This is the reason why a person is sleepy. There's always a person like, tired. Always they don't want to do exercise and so on. It could be that reason. All right. It could be many different reasons. All right, so viscosity, we already discussed this already. Now, velocity is another thing that we need to talk about. The blood velocity changes as it travels through the blood circulation, called the systemic circulation, because it's supposed to go and reach the tissues. It is inversely proportional to the cross-sectional area. Inversely proportional. What does that mean? That means when you have a lot of cross-sectional areas, the velocity is lower. All right. And opposite, when you have less cross-sectional areas, the velocity is higher. All right. So let's go ahead and take a look at that. First of all, we need it because we need to have a lower velocity at the tissues, the capillaries feeding off the tissues, so they could exchange substances. Yes, the diameter is getting smaller. Yes, one red blood cells at a time passing through, but they're also going slower. So allowing substance to get exchanged. All right. I don't know if this would help, but think about the train is going forward. All right. But when it gets to the, a station, it doesn't completely stop, but it's slowing down in here. While it's slowing down, passengers can hop in and hop out. Passengers are kind of like analogous to exchange that are happening. This could be nutrients, oxygen, carbon dioxide, all that stuff. And then again, once this is in the capillary, capillaries, as you know, they have the highest cross-sectional areas. And then, boom, they're going fast again. So if we go ahead and take a look at the graph right here, you could see on the y and the x-axis, you could see different blood vessels, and on the y-axis, you could see the velocity. All right, velocity is the lowest on the capillaries, which makes perfect sense, by the way. One, because they have the highest cross-sectional area. All right, right here. And What does that mean? That means if you cut right in the middle, the cross-sectional areas right here is huge versus you cut in here is little. You have to add them up, not just like looking at one only. All right, so there's more cross-sectional areas in total. Right, so capillaries basically they have the lowest velocity, which makes sense. Again, train is coming fast. They don't completely stop, all right, but that's enough for the exchanges to take place and then picking up the speed again. All right, so that's velocity. Now, there is a auto regulation. Automatically, blood can adjust itself, depends on the requirement. When you're exercising, blood vessel dilates, increasing the flow. All right, when you are resting, it restricting the flow. So it really depends on the need of the body. All right, what are you trying to do? Where is it needed? And that's where the diameter can all get altered. Now, there is a myogenic control mechanism. I'm probably going to ask you this myogenic control mechanism uh, on the next or during the kidneys when we discuss that thoroughly. But basically, blood vessel is smooth muscle uh, moving. Automatically, they adjust whether they are constricting or releasing. They respond to the vascular pressure. All right. So uh, this is again, I would rather not ask you right now. So if you wanted to wait a little bit later, you could kind of like take a look at it. But you're trying to adjust things basically, and it really comes in alive in the kidneys. When we discuss that, you will learn that. I think you have enough information for now. The circulatory pathway, pulmonary circulation versus systemic circulation. So from the, oh, you got to know the pathway of the blood. We discussed this already early on in the previous lecture. But pulmonary circulation, you're going from the heart to the lungs, from the lungs back to the heart. Systemic circulation, you're going from the heart to the tissues, from the tissue back to the heart. So those are the circulation. Again, the differences between the arteries and veins, some of these differences we discussed already. And here you can see the right side of the heart and the left side of the heart deals with different oxygen poor blood or oxygen rich blood, which demonstrated in blue and red respectively. And you could see this is the pulmonary circulation and the blood vessels that are associated. And this is the systemic circulation. These demonstrating the tissues right here, etc. All right. So overall, we looked at the structure. You need to know the structure. We looked at uh, direction. We looked at the content, oxygen poor blood, rich blood. We looked at the structure was the, tunica media, tunica externa, tunica intima, and capillary didn't have a direction. Again, blood goes away from the heart in the arteries and so on. Content I just told you about. Pressure, higher pressure in artery, lower pressure in vein and such. If you're watching a movie and all of a sudden this samurai guy comes in with the sword and slashes his opponent and blood is gushing out, which of the blood vessels do you think the person ruptured? You want to pause the video? It'd be arteries, because arteries have the greatest pressure. That's why the blood is gushing out, right? So we looked at the pressure. We looked at the factors helping out this low pressure of veins. That would be the diameter. That would be the valve. That would be a respiratory pump and the muscular pump, right? Okay, so we discussed that as well. We'll discuss velocity. We discuss factors affecting the blood pressure. All right, factors affecting the blood pressure. The formula that we went over, cardiac output is equals to the, I'm sorry, blood pressure equals to the cardiac output multiplied by the peripheral resistance. We looked at factors that are affecting peripheral resistance, blood vessel length. We discussed the, the diameter, and we also discussed the viscosity. Okay, so there you have it. This concludes our chapter, and we discuss about the baroreceptors, the regulation of it. All right, so this concludes our chapter, and that's it. I hope you guys enjoyed the lecture and you learned something, and see you guys soon.